The honest answer is nobody knows why varicose veins occur. There are various factors that may make you more likely to develop varicose veins. Those are such as having a family history, i.e. your parents have varicose veins, if you are overweight, if you're female and that you've gone through a pregnancy, and if you smoke. These are all factors that are associated with the development of varicose veins. There are some other environmental factors that may make it more likely for you to develop varicose veins, such as having an occupation that requires a large amount of standing. Patients with varicose veins may get pain over the veins themselves, or itching and aching. Towards the end of the day, they will tend to get some more swelling, and they may get more pain during the end of the day. This is due to the fact that what we call venous hypertension has developed in the leg and the foot. The reason for this being is that as the blood has not been emptied out of the leg and foot as well, this means that there's a buildup of pressure that activates the pain receptors in the leg, and that gets the patient to experience having more pain in the leg when the legs are slightly more swollen, or after they've been associated with somebody doing a lot more standing. The key things that you can do at home is not to spend hours standing still in one position. The key thing is to walk around, exercise your calf to encourage blood to return towards the heart. And if you are watching the TV or something, don't have your legs down, have your legs up so that they are, inverted commas, at the same level as your heart. Now, these things will all help relieve symptoms, but they won't actually prevent varicose veins from developing. And I think that's quite important. It's also important to know that there is no clear evidence that wearing compression stockings will actually prevent varicose veins developing. And once you have got your varicose veins, the key thing is that you should be assessed by a clinician to see what is the most appropriate treatment for you. Exercise cannot cure varicose veins. Some of the symptoms that people experience by exercising can actually be reduced by use of the calf muscle pump. But what is interesting to note is that when we did the NICE guidance on varicose veins, which I chaired, we actually found some evidence that people who do extremes of exercise are actually more likely to develop varicose veins and have problems with varicose veins. So it is very important that you look at the amount of exercise that you are taking. The key exercise that is probably the best for varicose veins is actually straightforward walking. The key thing is, if you have got the various symptoms in your leg, the answer is obviously to have your legs up. You may feel that you want to have in bed a pillow above them. If you're watching the TV, you might want to have your legs up on the sofa or with some cushions. But the key thing is to have the legs elevated so that it encourages the blood to return to the heart. The treatment of varicose veins has certainly changed quite dramatically in the last 10 to 15 years. Rather than what was traditional surgery under general anesthetic, patients can undergo interventions under local anesthetic, and this can involve either using laser or radiofrequency put into the vein to burn the vein and close it off. You can use glue, or you can use chemicals to also get exactly the same effect to close the main veins off. More superficial veins you can inject or hook them out under local anesthetic. And we've seen quite a significant change, as I said, over the last 10 to 15 years. And this is all reflected in the NICE guidance. So basically, you should be able to be treated as an outpatient. The key thing is that all the evidence suggests that if you have got significant symptoms from your varicose veins, you should not just be told to wear compression hosiery and get on with it. NICE and all the interested bodies in the management of venous disease fully recommend that you should be seen and offered a treatment on your incompetent veins rather than just be given compression hosiery. Now, the key point is that NICE made some very clear recommendations as to when you should seek medical attention. And it is very clear that providing you are having symptoms in your leg, either of aching, pain, some leg swelling, if there's a history of phlebitis in the veins, or if you have previously had a leg ulcer, or you have a new leg ulcer, or you have some skin changes in the leg, these are all indications that your GP should refer you to a vascular specialist to be seen. So basically, if you have symptomatic veins, you should be referred to a clinician. Obviously, if you have varicose veins that aren't causing you any symptoms, or very fine thread veins, these are cosmetic issues which you then have to resolve and decide whether you want them removed. But there is not a medical indication to have those treated, but they can be removed on the grounds of cosmesis.